Hi guys, welcome back. So today we're going to be talking about hepatitis B. Hepatitis B is it's actually quite an incredible virus. So hepatitis refers generally to an inflammation of the liver. There can be a bunch of causes for that, including a whole bunch of different hepatitis viruses. Hepatitis B is very interesting. It used to be right up there with hepatitis C as one of the leading causes of hepatocellular carcinoma, so cancer of the liver, and liver cirrhosis and things like that. Now that we've got medications that can very effectively treat hepatitis C, the effect of hepatitis B has really gone up in comparison to that. So it's still a major cause of morbidity and mortality worldwide. It's a very interesting virus, as I said. So it's a double-stranded DNA virus. And as you can see, it's got this lipid envelope surrounding it. And then a protein capsid around the actual nuclear material. So that membrane envelope is really important because so we have a few different types of hepatitis viruses. We've got A, B, C, D, and E. So A and E are both acute versions of hepatitis. They're acute illnesses as opposed to these guys, which are chronic. So these are both fecally orally spread as well. So they're basically you ingest them in your food or something like that. So you may have heard, if you're in Australia, you would have known about the big outbreak that we had in frozen berries. So these are ingested and then they get to the liver that way. So they don't have that lipid envelope. But these guys, specifically B and C, have got this lipid envelope, which means that you can't take them orally because the stomach acid would destroy them. So these guys are spread by methods such as IV drug use. They can be sexually transmitted, blood transfusions, all those kinds of things. So anything that kind of breaks the skin, tattoos even, all those kinds of things. Hepatitis D is an interesting one. It's very closely related to hepatitis B. I might cover these in a bit more detail in another kind of video, but for today, I just really want to focus on hepatitis B. So as we said, spread via some kind of break in the skin usually, so through the blood. And what they do is they're really interesting because they've got this ability to form a very stable kind of state in the cell, and that's how they become chronic. There's the big thing I want to focus on today is the serology. So serology is like looking at the blood and looking at the antigens that are present, the antibodies that are present, all those kinds of things to be able to tell if someone is infected currently, if they have been infected in the past, if they're immune, all those kinds of things. There's a few different terms I'm going to be talking about today. So we've got, I always get this wrong, big B. So this, you can see this here. The virus has got a number of really important antigens. So you've got the core antigen here, the the pre-core antigen, and the surface antigen here. And we'll go through what each of those things are. So the surface antigen, it's this, as you can see, it kind of pops up. It's on the surface here that's present. It's really important in kind of confusing the immune response, because what can happen is that this virus can secrete these big long strands of the hepatitis surface antigen. And so it's secreting these massive big chains of it. They're very, very immunogenic, which means that the immune system can respond to these very rapidly. And so because it sees this big, it's essentially like you have this and then you've got this tiny little virus here with all that surface antigen on it, which is trying to get into the next hepatocyte, so the liver cell. And so to do that, it needs to leave. And when it leaves, it's very much exposed to the immune response. So by secreting these big long chains, it's almost like you've got a little Brussels sprout compared to a massive chocolate fountain to the immune system. The immune system goes straight for these guys, produces a very strong immune response to this, which allows the little Brussels sprout, the little actual virion, to hop between hepatocytes and continue the infection. So that's why that's really important. The other antigens here, so you can see there's this core antigen. So the core antigen is basically, it kind of is forming this layer of the capsid here. We'll discuss it a little bit more. Basically, if you see that there's core antigen present, it means that the virus is actively replicating in someone. So that means someone's infected. The other one that we have here is the pre-core. The pre-core is also really important. If you find this in a person, that means that they have active hepatitis B infection. The virus is actively replicating, similar to the core antigen. This antigen is really cool, actually. I say cool, like this virus is very deadly, but the way that it's evolved to withstand the immune response is very interesting. So the pre-core antigen, as well as being involved in replication, it's also soluble and it's secreted by virally infected cells to tolerate the immune system. So it's what we call a toleragen. And so what that means is that when the immune system sees it doesn't generate a strong immune response. It actually downregulates the immune response. And in doing that means that it kind of protects the hepatocytes that are infected from being killed. And in doing so, it allows the virus to continue to replicate. So it's very interesting by damaging that immune response. The last thing as well that I'd like to talk about, it's not in this diagram so much. It's what we call this covalently closed circuit DNA. This is very important, and if you go and do any kind of research into hepatitis B, you'll hear about this. It's a little bit complicated to explain, but basically what happens is the hepatitis B DNA, as you can see it here, when it gets into a cell, it can form this really cool kind of structure that's almost like this. It's these three little loops. They're very tightly coiled, and they can go and they can sit in the nucleus of a hepatocyte, and they can stay there forever. And that means that if that happens, you get chronic infection. That chronic infection is very, very, very difficult to clear. And so there's a lot of research happening at the moment into this triple C DNA in order to try and figure out if there's a way that we can target this to clear the infection. So as I was mentioning before, hepatitis B and hepatitis C used to be major drivers of these cancers. We now have cures for hepatitis C, but we still can't beat hepatitis B because of this CCC DNA. It's very hard to cure, very hard to treat. Okay, so then say you've got a patient that's come in. For example, they might have just got back from Southeast Asia where they got a new tattoo. They might have had a few unprotected sexual encounters, and they might also be a IV drug user. So they kind of this massive cluster of risk factors, and they've presented to your ED. They got back, maybe 2 to 3 months ago. So the incubation period for hepatitis B is usually around 60 to 90 days. So they've gotten back from this trip around 60 to 90 days ago, and they're starting to feel very sick. They're looking quite jaundiced, so yellow skin, and they're vomiting. They're feeling very unwell. What we'd do is we'd get a serology test. So we'd take some blood from them and test them for all these different things. So we've already talked about this hepatitis B surface antigen. We'd also look at the anti-hepatitis B surface antigen again, but these are the immunoglobulin. We'd also look at anti-hepatitis B core immunoglobulin, and we'd look at both IgM and IgG. We'd also look at the hepatitis B pre-core antigen. We'd then also look at anti-hepatitis B pre-core immunoglobulin. And lastly, we'd do a hepatitis B viral DNA titer. And so what that's doing is that's actually measuring the amount of DNA amount of hepatitis B DNA that's in the blood. Okay, so what would all these mean? So hepatitis B surface antigen, as we said, that's a marker of whether you, as to whether there's active infection kind of going on. So if you've got antigen present, it's a decent sign that that they're probably infected. What we look at probably more closely is this hepatitis B surface immunoglobulin. This is important because most patients that you test, especially in Australia, are actually going to be positive for this. And that might be really confusing. So if you've got someone coming to your ED and they're presenting with what you think is hepatitis, and you do the screen, you find that they're immunoglobulin positive, you might be quick to jump and say, oh, if something's positive, that means they must be infected. But what's important to consider here is that this is what the vaccine is made of. So in anyone that's been vaccinated, we would actually be hoping that they would be the immunoglobulin positive, because that means that they're actually immune. They're not going to be able to get infected. So this can be a little bit troubling as well, though, because it means if everyone you're testing is coming through is Ig positive for the surface antigen, how can you tell if they're positive because they've had an immune response and they've cleared the infection, or because they're generating an immune response to it, or because of the vaccination? So this is only one part of it, and that's why we have to do the rest of the screening to make sure that what we're seeing is not because we can't assume that the reason that this is positive is because of the vaccination or because they're infected. So then what we look at is we look at the core antigen, and we look at the antibodies that have been formed. If we see this here, IgM, the way that infections work is that with B cells, the first antibody that B cells produce, the first immunoglobulin, is M-type. So they produce IgM first. That's basically a soluble form of the B cell receptor. So if we've got the B cell here, they've got these receptors in their membrane, which are antibodies, they're IgM. And if, say, they bind to the virus, they internalize it, before they can get activated by T cells, these guys will, once they're activated, will immediately start secreting pentamers of IgM. So that happens as soon as the B cell sees it. It doesn't need any other activation or anything. It will immediately start secreting IgM. And so this is a marker then of acute Hep B infection. If we see IgG present, what happens is with an immune response, as time goes on, this IgM, it's okay, but it's not very strong at binding, and it's not very good at activating a very intense immune response. So we need to upgrade it. And the way that we upgrade it is we upgrade it to IgG, which is just a single antibody. It doesn't form a pentamer, it's a monomer. And it does this we recruit T cells, and I will make another video and post it that talks more about this kind of concept. But the T cell comes up, it sees that this B cell has recognized the antigen, and this T cell is basically telling the B cell, yep, you're right, that is a foreign antigen, that's not a self antigen. This is something that we need to fight, so I'm going to let you upgrade from making IgM to your secreting IgG, which is a lot stronger. It's going to result in a much stronger immune response. So because this takes time, we use this as a marker of chronic infection. And usually what we do, so this is the core IgG as well. This is often used to monitor someone who's come in with chronic infection. So in a lot of countries where vaccination isn't very routine and hepatitis B levels are very high in the population, children born to a hepatitis B positive mother will be infected basically at birth. And if then that infection isn't cleared, it becomes chronic very, very quickly, and it's very hard for them to clear. So if they then come to a hospital and need treatment long-term and need to be monitored long-term, they'll use this IgG as a marker of infection, and just to see if they're actually clearing the infection or not. Okay. So it's not used so much, I guess, in the acute setting. This is more used to look at response to treatment and things like that. Then we have the pre-core antigen. As I say, if we see this in the blood, this immediately we can assume this person is undergoing viral replication. So this means that they're actively infected. You know, if someone comes up to you with hepatitis, with all the symptoms of hepatitis, you test, you see that they're pre-core positive, you see that they haven't really generated a very strong surface antigen response, and you know, you can see that they've got IgM for the core antigen, and the antibodies, then that gives you a pretty good idea that you know, they're probably infected with hepatitis B. This is pretty strong evidence. So if you see this pre-core antigen, it's almost immediately should be right in the top of your mind that this person is has an active viral infection with hepatitis B. If we see the immunoglobulin, this is important. This is actually protective. So if we see this indicates to us that the virus is no longer actively replicating. Which is important. But they can still be surface antigen positive because of integration into the nucleus and things like that of the DNA. So what this means is, so if you see someone coming in and you see that they're surface immunoglobulin positive, and you're like, does that mean they've been infected, or if it's just from the vaccination? And then you see that their pre-core immunoglobulin is present as well. That gives you a pretty good indication that they have actually been infected with hepatitis B before, and that they've now generated some kind of equilibrium, some kind of balance with it. So the virus is still going to be present, and it's going to be present latent in those hepatocytes, but it's no longer actively replicating. It's not actively dividing, actively infecting new cells, all those kinds of things. This is not always a great indicator. So if this is positive, but you're seeing someone with very strong symptoms of hepatitis B, and everything else is pointing to it, there is this thing called an escape mutant. And what happens with escape mutants is basically, even if they're immunoglobulin negative, the virus is still actively replicating, and the virus has just evolved to get rid of this pre-core bit so that the immune response doesn't recognize it. And so that it's not always the most accurate test. It's a fairly accurate test if it fits the clinical profile, but keep in mind that there is this thing called an escape mutant. And the way that we can get around that, the more sensitive test, is this HBV titer. So by looking at this lets us actually know very accurately the level of viral replication in the blood. If this is very high, that tells you that the virus is replicating very quickly, and you're in an active infective response. If it's quite low or if it's negligible, then that means that depending on what the rest of these things, it means that they're not infected or the infection is currently latent. So this is probably more useful clinically now if you do these kinds of titers. And I guess that's pretty much it. So this can take a little while to get your head around about what all of this means. If you can find some examples online, that's probably the best way to do it. But just to give a quick recap, most people are going to be surface antigen immunoglobulin positive, especially in countries such as Australia, because of our vaccine, which is actually just basically pure HBS. So we generate a very strong immune response, very strong protective immune response. So if people have got that vaccination, they're going to be that Ig positive. If we see core antigen IgM positive, that gives us an idea it's an acute. If it's IgG, then it's probably more chronic. If we see core antigen, then that tells us that the virus is actively replicating at the moment. If we see the pre-core immunoglobulin, that tells us that it's no longer actively replicating with a certain amount of certainty. However, we need to be mindful that there are things called escape mutants, which will be they'll be pre-core immunoglobulin positive, but still have active disease. And if this is positive, our HBV DNA, that then tells us it is definitely still active, and is actively replicating. I hope that helped, guys. As always, please leave any comments about anything else you'd like me to cover. If I didn't explain something well in this video, you'd like me to explain it again. And any kind of feedback you have, I'd really appreciate it. And yeah, just leave all comments below, and I will read over all of them. Thank you, guys.